BWHI recognizes the importance of elevating and bringing continued awareness, research, and solutions to creating sovereign spaces, meaning spaces that are full of power and autonomy over creating and manifesting the highest potential and optimal health for Black people and birthing families in the US. So, with our maternal mental health conditions, we know that maternal mental health conditions are some of the most common complications of pregnancy and childbirth in the US, and that Black women experience higher prevalence of maternal mental health conditions, particularly postpartum depression and anxiety relative to the US as a whole. Studies show that with maternal mental health, structural racism, which is the totality of ways in which society that fosters racial discrimination and that is operationalized through policies, such as housing, education, healthcare, and employment. And this creates and perpetuates significant inequities in terms of diagnosis, in terms of perinatal and mental health disorders. We also know that if our pain is constantly ignored, as we see in our maternal health journey in this country, then our mental health will be ignored and, frankly, probably won't even be a thought. So it's critical for us to understand why more Black women and birthing people report symptoms of mental health problems, and why we also have the lowest diagnosis and are not receiving adequately treatment for these conditions. Maternal mental health stretches beyond that the mother or Black birthing person, and in turns impact the entire family unit. We rarely consider the impact of maternal mental health has on the family unit and partner, but it's important that we do so, that we understand maternal mental health impacts the entire family unit, and it is critical to find interventions that can help address this struggle that we're family and that each family member is also facing. So today, without further ado, we have Kay Matthews, and I'm going to do some abbreviated introductions so we can just get right into it. Kay Matthews is the founder of the Shades of Blue Project and is a licensed community health worker. Kay, along with her team, is on a mission to uplift all birthing individuals with care, respect, and the dignity they deserve, no matter the social status or birth outcome. Based on Kay's own experience, she recognizes the critical diversity gap in mental health, resources, and emotional support for Black and minority birthing individuals, which is what her organization works to dismantle through work on the ground and advocacy. Next, I will introduce our return panelist, Dr. Karen Sheffield Abdullah. Dr. Karen is a nurse scientist and midwife whose interests focus on the utilization of holistic, integrative, and multi-sector strategies to promote physical, mental, and emotional well-being for individuals and communities. She is particularly interested in developing strategies to reduce the long-term health effects of psychological trauma, anxiety, and depression on women's health and birth outcomes. Karen's program of research facilitates the development of culturally relevant interventions to reduce disparities in stress-related adverse outcomes during the perinatal period and provide a platform to guide successful models for women's health care provisions and that incorporate